pleasure to participate in this important forum. As Dr. Davis has already indicated, when I was the director of the University of Pittsburgh Cancer Institute, Dr. Davis brought this to my attention, and in going forward with this, I became convinced that there was enough indication for increased risk from cell phone radiation related to cancer that I put out a directory, an advisory to the faculty and staff at the University of Pittsburgh. And the precautionary advice that we issued back 4 years ago was in the same vein that Dr. Davis has already mentioned. The key thing was to keep the cell phone when on away from the body. So we advised to use instead either the speakerphone or use earpieces, and specifically to keep the phone away from the body or in the pocket when it's turned on. There was also a warning about avoiding areas where there's weak signals, because this increases the intensity to try to connect. We particularly wanted to warn against protection of the abdomen, especially in either pregnant women or adolescent females, or in males wishing to become fathers in relation to the effect on sperm that we used something about 4 years ago. Even at that time, a number of countries and the European Environmental Agency advised cell phone precautions. I had the opportunity to testify at a congressional hearing in the last part of 2008, and one of the comments that I made in conclusion was that I cannot tell you that there definitely are risks from cell phone radiation, but I certainly cannot tell you that there is no health risk from cell phone radiation. And I stress that because this is diametrically opposed to what the cell phone industry tells us. So what's going on in the last 4 years? The number of studies on safety of cell phone radiation are increasing. There are now quite a number of studies that relate to risk for a variety of different diseases. And in particular for this morning's forum, there's been a mounting number of studies of children's health and cell phones. There's also been an increasing number of studies in young animals. All of these studies deal with the health risks, and a number of them point towards increased risk from cell phone radiation. The currently used model for rating all of the cell phones through the specific absorption ratio has been based on a model called SAM, which has an 11-pound head, the configuration of a male individual greater than 6 feet tall and more than 220 pounds. And among the 5.5 billion cell phone users today, an increasing proportion is smaller and younger than the current model. Back in 2008, we had these data from Dr. Om Gandhi indicating that in models against the head, there is considerably more penetration of the cell phone radiation into the brain for 5-year-olds, less in 10-year-olds, and considerably less in adults. And this causes particular concern about the very young children. This is a model focusing on the abdomen of pregnant women with different stages of gestation, indicating that there's a significant amount of penetration of the radiation into the fetus. This is another indication of more modern techniques looking at the amount of distribution in 3-year-olds, 11-year-olds, adults, and as one gets older and becomes more mature, the skull thickens and protects to some extent against the penetration into the brain. Now, there have also been a number of negative studies which the cell phone industry puts forward to say there's nothing to worry about. But actually several years ago, there was a detailed study to indicate what the relationship or correlation might be between the sponsorship of studies and what the results are showing. And there's a very clear and significant bias with industry-sponsored trials mainly showing negative results, whereas for independently funded studies, the majority clearly shows significant risks for cell phone radiation. During the last 4 years, the case for preventive measures has increased considerably, as I've summarized, and Dr. Davis has already alluded to. You'll hear more of this during the course of this forum. There's increasing biologic data for DNA damage and other adverse effects that will be talked about. There are more epidemiologic studies to support cancer risk, especially among teenage children. As Dr. Davis has already pointed out, there is increasing use of cell phones by children, and there's more evidence from cell phone radiation models for increased risk in children. And therefore, after 4 years of this concern since I entered this, what I said 4 years ago certainly has been confirmed, but it has also made me increasingly concerned about the evidence that is mounting about health risks from cell phone radiation. Thank you.